Yeah, good evening. Good evening, everyone. Yes, so today is the perfect time, I suppose. Yeah, we have Gayatri, Kanchandeep, DJ, Ritika, Duke of Doom. Yeah, let's go. Good evening, everyone. I hope the audio, visuals, everything is fine as of now. Yeah, yes. So, Sama, good evening. Alim, hello. Narv, good evening. Devendra, Mohammed Yasir, Kabir. Yeah, good evening. Good evening, guys. Suchit, just let me know, guys, if the audio and visuals are very much fine. I hope you are able to hear me well. The audio visuals are perfectly fine. Just give me a thumbs up in the chat box so that I can start without wasting much more time. Suchit, hello, bache. Hello, hello. Okay, perfect. Perfect, Devendra Pal. I think everyone is over here now. Okay, okay. Chalo, let's start with the session. Okay. Are you not able to hear me well? I think this is fine. Chalo, let's start. Rishi, hello. Yeah, let's start with the class. So now, guys, in the previous class, I have discussed about the cell injury. Okay, we have discussed about the cellular adaptations and have discussed all the four types. Today, I will be discussing about the reversible and the irreversible cell injury. So we already know that cell injury occurs due to when there is less of oxygen is available. Yes, when there is. So put the heading as the reversible cell injury. And today we will start with the discussion on this particular topic. Okay. So yes. So guys, you're very well aware that yeah, एक बार अपने end पे भी check कर लो. I hope the voice is like perfectly fine. What he has done with it. Is it like echo is there? Just let me know. Now everyone is aware that there is decrease in oxygen. Okay, and this decrease in oxygen. Okay, you already know that what is the most common cause for any kind of cell injury? It is the hypoxia. Okay, it is hypoxia. And remember, hypoxia basically means decrease in the levels of oxygen. Okay, and can anyone tell me in the chat box that what is the most common cause of hypoxia also? Okay, what is the most common cause of hypoxia? Can anyone tell me in the chat box? Okay, yes, Vidhi, very good. Vidhi, very good. Perfect, beta. Minakshi, okay, I don't know what you have written. Vidhi is very good. Okay. Ischemia. Perfect. Perfect, Abhishek. Perfect. Perfect, guys. Perfect. Ischemia. Hacker, Alim. Yes. Osama, Minakshi. Yeah, it's oxygen deficiency that is happening due to ischemia. Mohammed Yasir. Very good. Very good, guys. Okay. Perfect. So everyone is aware that if there is decrease in oxygen, what is the most common organelle that will be affected? You are very well aware, guys, that it is the mitochondria. It is the mitochondria that is affected. Okay? It is the mitochondria that is affected. I'm just not using mic right now. Now let's see how does the sound works. Just let me know if the sound is like, yeah. So it is the mitochondria which is affected, or yeah. You already know that oxygen is required for a various number of metabolic processes. And if there is decrease of oxygen in our body, the most common organelle that will be affected first, that is mitochondria. That is mitochondria. And you already, I have told you that mitochondria is known as the powerhouse of the cell because it is helpful in generating the ATP. Now, if the mitochondria is dysfunctioning or if it is not functioning properly, okay, due to lack of oxygen, what will happen? There will be a decrease in amount of the ATP, that is the energy currency of the cell. ATP is also known as the energy currency of the cell. It is also known as, no sound is there. I was expecting a problem, right? That's why I was not about to. Guys, just let me know if there is any problem as of now. Just let me know, guys, if there is any problem as of now. Are you able to hear me properly, clearly? Then I will know, proceed with the subject, proceed with the topic. Rebi is saying fine. Minakshi is saying yes, it's okay as of now. What about rest, guys? महबूब संजना ओके विधि क्या दिक्कत हो रही है बच्चे एको प्रॉब्लम है एको किस वजह से एको आ रहा है क्योंकि यहाँ तो कुछ भी नहीं है ऐसा एको मतलब प्रोड्यूस हो रहा है कोई बैकग्राउंड से नॉइज आ रहा है क्या हो रहा है मतलब okay just see guys if it's like audible visible now that is the least I can do right now okay. Anushka Bachi, good evening welcome to the session on cell injury part 2 yeah Minakshi, I hope it's fine. Everyone, please just give me a thumbs up that you guys are ready to study as of now. Okay, perfect, perfect. Okay. So everyone is aware that. The most common cause of cell injury is the hypoxia, that is decrease in the levels of oxygen. Okay, and you already know that decrease in the levels of oxygen will first affect the mitochondria of the cell, that is the powerhouse of the cell, and in turn there will be a decrease in the production of ATP, and in turn there will be a decrease in the production of ATP. Okay, and decrease in ATP will have various effects. Okay, it will have various effects. It will affect the cell membrane. It will affect the cell membrane. Yeah, it will affect the cell membrane. Apart from that, it will affect the endoplasmic reticulum. Okay, and can anyone tell me in the chat box that which type of endoplasmic reticulum is responsible for protein synthesis? And yeah, I'm waiting for your answers. But apart from that, there is multiple changes in the nucleus also. Okay, there is multiple changes, miscellaneous changes in the nucleus. There is miscellaneous changes in the liver as well. Liver as well. Okay. Yes. Rough endoplasmic reticulum. Very good, Minakshi. Very good, Vithi. Very good, Mehboob. Yeah, I want everyone to be like answering. Short gaming. Very good. Mohammed Yasser. Spelling. ठीक है, I'm asking a different question right now. Yeah, Abhishek. So decrease in ATP will in turn affect the different organelles, different parts of the cell, and it will affect the cell membrane, the endoplasmic reticulum, the nucleus, the liver. Okay, liver. Okay, liver. Okay, I'll tell you the changes in the liver later on. Okay, I'll tell you the changes in the liver later on. Yeah, you will see a fatty liver. If there is a decrease in the levels of oxygen, decrease in ATP, obviously there will be a fatty liver change. There will be accumulation of lipid droplets. Okay, so now guys, what I'm going to show you right now, it is the electron microscopy. Firstly, just focus on the image guys, because now I have included multiple images in today's session. Okay, so yes, I'm showing you electron microscopy of mitochondria, of mitochondria. Now, firstly see that it is the first one. It is a normal mitochondria. It is a normal mitochondria. It is a normal mitochondria. And the second one, basically the mitochondria which is affected in, still there is a echo guys. Still there is an echo guys or not? Just let me know. What has happened to. Just a moment guys. I'm just fixing it. It's not answering my call. You like या just see the eco issues आ रहे हैं एक बार आप देखिए just try to आपने कुछ साउंड के साथ चेंजेस किए हैं क्या पहले तो कभी नहीं हुआ ऐसा like continue okay I'll see you're done whole system you have just okay perfect sorry for the delay guys I hope now my voice is perfectly audible I hope now my voice is perfectly audible to you people I hope there is no echo now I don't know what was the issue going on guys let us continue the topic it has been like I just started with the topic already 15 minutes it's like wasted as well Sure. So guys what I'm trying to show you over here it is the picture of a mitochondria okay the electron microscopy guys electron microscopy microscopic image of mitochondria I'm showing you the microscopic images of mitochondria guys there are two mitochondria right now over here the very first one that you can appreciate over here okay it is a tubular structure the mitochondria over here it is a tubular structure guys okay these are elongated tubules okay these are elongated tubules and along with the elongated tubules you can very well see there are multiple striations that is called as crista which is very well defined in this microscopic image you can see the presence of crista or cristae that are very well seen in the electron microscopy so yes it is the picture of a normal mitochondria the normal mitochondria yes but whenever we talk about any cell injury okay whenever we talk about any cell injury and especially about the reversible cell injury what is happening there is loss of cristae you cannot very well identify the presence of cristae so over here the cristae is lost or you cannot very well differentiate cristae in this particular image. Also, the elongated tubules, the elongated mitochondria has swollen. Okay, the elongated mitochondria has swollen due to accumulation of water. Okay, it has swollen. Okay, so it is roughly a spherical shaped. You can see a spherical shaped mitochondria in reversible cell injury. So that's the difference between a normal mitochondrial image like electron microscopy, the normal mitochondria, and one which is undergoing reversible cell injury. Okay, yes. So now everyone is aware. So the very first one that we will start with the reversible cell injury that is the cell membrane. And everyone knows that in the cell membrane there is decrease in ATP. Okay, there is decrease in ATP. Yeah, there is decrease in ATP. Now, decrease in ATP, everyone knows that in a cell, okay, in a cell there is a pump, okay, there is a pump which is functioning because of this ATP. Okay, there is a pump which is functioning because of this ATP. Can anyone tell me the name of this particular pump? I'm waiting for your answers, guys. Can anyone tell me the name of this particular pump? Yes, I'm waiting for your answers in the chat box. Anyone who would like to tell me the name of this pump which is functioning with the help of this particular ATP? Yeah. Yes, Minakshi Chauhan, very good beta. It is the sodium potassium pump. You can very well appreciate that the sodium will move out of the cell and potassium will move inside the cell, and that pump is basically working like with the utilization of ATP. Yes, it is the sodium potassium ATPase pump. Osama Sheikh, very good. Abhishek, very good. Now this is happening in a normal cell. This is happening in a normal cell. Now, what is happening, guys? If suppose there is ischemia, okay, or I typically say if there is decrease in blood supply to the organs, that is ischemia, you already know it is decrease in oxygen, okay, and if there is decrease in oxygen, there is decrease in the amounts of ATP because it is, yeah, it is the oxidative phosphorylation which is involved in the production of ATP. So the oxidative phosphorylation will decrease. Okay, now what will happen, guys? This was a normal cell. This was a normal cell, but now the ATP production is decreasing, or there is a less ATP production. So no, now what will happen? The sodium which was moving out of the cell will now move inside the cell. The sodium will now move inside the cell because ATP was earlier, it was retrieving the sodium out of the cell. Now the sodium will move inside the cell, and along with the sodium, it is the water that will move inside the cell. It is the water that will move inside the cell. Okay. And apart from that, guys, what will be the outcome? Yeah, the potassium will flow out. There will be potassium efflux. There will be potassium efflux. Okay, so you can very well see the difference between a normal cell, okay, where there is utilization of ATP, where there is sufficient ATP present. But as soon as the levels of ATP decrease in any type of cell injury, okay, we are talking about the reversible cell injury, the sodium and water will move inside the cell. Now can anyone tell me कि जब water cell के अंदर चला जाएगा तो water के अंदर क्या देखने को मिलेगा? Water will, what will be the change in the cell? Water will, the cell will, yes, I want the fatty नहीं है मतलब, yeah, anyone like to like, hmm. Yeah, swelling of the cell. Obviously जब पानी सेल के अंदर जाएगा तो सेल ऑटोमेटिकली स्वेल कर जाएगी. So that was, yeah, so decrease in ATP will further lead to decrease in the sodium potassium pump activity. The sodium potassium pump activity, okay, what it will do, it will increase the amount of sodium inside the cell. Yes, inside the cell. And increase in sodium inside the cell will in turn favor the water inside the cell, water inside the cell, okay, and it will lead to, characteristically it will lead to cellular swelling. It will lead to cellular swelling, okay, or it is also called as hydropic change. It is also called as hydropic change, okay, and mark this as the first important question, okay, that is the first microscopic feature, first microscopic feature that you will encounter over here, the first microscopic feature that you will encounter over here, okay, that is the hydropic change. The cell will swell up due to the influx of water along with the sodium. So I hope till here everything is clear. Guys, just give me a thumbs up that everything is clear as of now. So we have just discussed there is a decrease in the ATP. Sodium ATP pump will not function because of the less amounts of ATP decrease, and ultimately the sodium will move inside the cell along with the water. The water will in turn force the cell to swell up. That is the first microscopic feature or the hydropic change that will occur. Yes, Osama, perfect. Revi, perfect. Yasir, perfect. What about rest, guys? Just give me a thumbs up, guys. I hope you all are like perfectly learning. Chalo, Abhishek, perfect. Perfect. So now you already know that cell contains microvilli. Cell contains microvilli. So apart from this cellular change, there will be cellular swelling. The other changes that you will encounter in the cell membrane, there will be a loss of microvilli. There will be a loss of microvilli. Apart from that, guys, you will be able to see there will be formation of blebs. Now, can anyone tell me what do you mean by the term bleb? There will be bleb formation. I'll just draw a simple image. You can just see there will be bleb formation. B-L-E-B, bleb. There will be bleb formation. Yes, there will be bleb formation. Yes, yeah, yeah. It is somewhat like these structures. You can see blebs are made. Yeah, these finger-like projections, outpouchings of the membranes of the cell. These are actually the blebs which will be like made. And apart from that, guys, you will be able to see very importantly, very characteristically, over here there is presence of myelin figures. Over here there is presence of myelin figures. That is ultimately one of the most important like damage which you are able to appreciate it over here. Yeah, it is the myelin figures or the presence of myelin figures. Okay, so yeah, we will write about myelin figures over here right now. So I'm just writing it over here. So now what are myelin figures? So as per the image that you are able to see over here, you can see that these are small spiral segments or fragments. These are small spiral fragments. जैसे एक प्याज के टुकड़े को काटते हो and just you just try to see it over there. So write down these are small and spiral fragments. Small and spiral fragments derived either from cell membrane, either from cell membrane or membrane of organelles or membrane of organelles. Okay, you already know that the cell membrane. Okay, can anyone tell me in the chat box majorly the cell membrane का composition क्या है? What is the major composition of the cell membrane? In the chat box, guys, I'm waiting for your answers. What is the major um yeah, the cell membrane, it is made up of majorly what? Main composition of the cell membrane. Yes, it is the phospholipids. Perfect, Osama. Rebi. Perfect. Siddhi, perfect. Perfect, guys. It is the phospholipids. It is the phospholipids. Yes, Minakshi, perfect. Perfect. बच्चे बाकी सब भी answers करो. I want everyone to answer the questions that I'm asking during the live lectures. Okay. So it is the yeah phospholipids. Yeah, it is the phospholipids. Zobia, perfect. Ritika, perfect. Just So ultimately, these myelin figures, what will be the composition, guys? Again, yeah, it is the phospholipids. It is made up of phospholipids. Phospholipids. Yes. Now these phospholipids are, yeah. Now these phospholipids, they can be like, um, they are degraded by which enzyme? These phospholipids are degraded by which enzyme? Anyone in the chat box would like to mention the name of the enzyme? These are due to denaturation of phospholipids only, but enzymes are phospholipase. Phospholipids by phospholipase. Phospholipase. Yes, yes, Osama, perfect. So you are very well able to appreciate the myelin figures, guys, over here in this particular structure. I have already told these are small spiral structures that you can appreciate over here. Okay. And these spiral structures are derived from the cell membrane. And what is the composition of the cell membrane? It is the phospholipids. So ultimately, these myelin figures will be ultimately composed of phospholipids. Okay, and these phospholipids are destroyed by phospholipase. Perfect, perfect, perfect. So just give me a thumbs up that, guys, you have understood the change in the cell membrane. Okay, the changes in the cell membrane, so that I can proceed with the next part. That is the endoplasmic reticulum. Reversible cell injury is done, I suppose. Yeah, in reversible cell injury, the change in the cell membrane is done. Again, audio issue, sir. Again, there is echo that is being produced. See, Osama, it's like working perfectly normal. Okay. Siddhi, Ritika, perfect, perfect, guys. अब ठीक काम कर रहा है, yes no कुछ बोल दो. So that I should start with the endoplasmic reticulum, that is the ER. Okay. यार सही काम नहीं कर रहा है क्या? क्या दिक्कत क्या हो रही है बताओ? ये ऋतिका नो क्यों लिख रही हो? इको आ रहा है क्या? बोलो, just tell me ना, I'll fix the issue then. Endoplasmic reticulum, guys, you are very well up here. Majorly, we will talk about the rough endoplasmic reticulum. The rough endoplasmic reticulum. The rough endoplasmic reticulum. And you are very well aware that if suppose there is a decrease in the ATP, if suppose there is a decrease in the ATP, you already know that decrease in the ATP, what will happen? The ribosomes that are the sites of protein synthesis, the ribosomes will break. Because of no ATP, the ribosomes will break away. And these ribosomes, if they break away, You already know the ribosomes are the site of protein synthesis, and ultimately there will be decrease in the protein synthesis, decrease in the protein synthesis, and if suppose also the protein is synthesized, the protein will not be of fine quality. It will be like not normal protein. Architecture of the protein will be lost, and ultimately there will be proteins formed, but that proteins will be not like the proteins that is required. So there will be misfolded. The proteins which are abnormal proteins, there will be misfolded proteins accumulation. There will be misfolded proteins accumulation. So if there is a damage, there is a decrease in the ATP due to the decrease in the oxygen, that is the oxidative phosphorylation. In endoplasmic reticulum, out of the two, majorly the rough endoplasmic reticulum will suffer. And in this rough endoplasmic reticulum, what you will see that the ribosomes, in the presence of less ATP, will break. Ribosomes are the site of protein synthesis. Ultimately, the protein synthesis will decrease. Or again, if there is a protein which is formed, the protein will be abnormal, and this abnormal protein will be accumulated inside the cell. Or I can simply say that it is the misfolded proteins accumulation. Sure. Coming on to the next, that is the miscellaneous changes. Now, guys, you already know that suppose if there is decrease in the oxygen. Now, according to your biochemistry knowledge, I want an answer from you people. If suppose there is a decrease in the oxygen, which glycolysis will take place in the body? Yes, it is the anaerobic glycolysis. Minakshi, very good, beta. Osama, very good, beta. Perfect answers. Yes, it is the Yeah, it is the anaerobic glycolysis. Abhishek, Yasir, Siddhi, perfect. Rimsha, perfect. It is the anaerobic glycolysis. Obviously, if there is ischemia, if there is less supply of oxygen to the tissues, ultimately that particular tissue will start doing glycolysis, and anaerobic glycolysis will increase. Now, my question to you people, if glycolysis will increase anaerobically, which substance will be accumulated in the muscles? Answer the question, guys. That's a biochemistry knowledge that I want to test over here. It is the glycolysis. Yes, Minakshi. Again, very good, Minakshi. I'll give you a hamper for this. You're answering very fast. Rebi, very good, beta. It is the lactic acid. Perfect. Lactic acid. ओसामा ने एक और पॉइंट का आंसर यहाँ पे दे दिया है ग्लाइकोलिसिस. Okay, glycolysis is increased. It means that there is increase in the contents of the lactate, and lactate is nothing other than the lactic acid. Ultimately, the pH will decrease. It will lead to acidosis. It will lead to acidosis, or there will be a decrease in the pH. Okay, there will be a decrease in the pH. Yes, everyone like has answered this particular question, that other changes what it can lead to, it can increase the anaerobic glycolysis because there is no particular oxygen left, production of lactate, and ultimately lactic acid is there. Acid means decrease in pH. Perfect. Now what changes it will, okay, what changes I will see in the nucleus, what changes I will encounter in the nucleus. You are very well aware, guys. Suppose this is the nucleus. Suppose, yes, very good, Minakshi. Yes. Suppose this is the nucleus, and in the nucleus, you can very well appreciate the nucleus. It is homogeneously shaped. We see in a normal cell there is homogeneous appearance of the nucleus. Homogeneous appearance of the nucleus. Yasir, you are right. Homogeneous appearance of the nucleus, and this, now there is acidosis in the body. What will happen? Now, if suppose there is acidosis in the body, what will happen? the nucleus will undergo change, and these chromatins will get folded. Okay, these chromatins will get folded, or there will be clumping of chromatin. There will be clumping of chromatin. Yes, there will be clumping of chromatin, or in a very easy manner, it is the patchy deposition, patchy deposition of chromatin material. It is the patchy deposition of chromatin material. So this acidosis, it will in turn destroy the architecture of the nucleus, the homogeneous appearance of the nucleus. What will happen? This will in turn, the chromatin will be condensed, or it will be like clumping of chromatin. Okay, that will be seen inside the nucleus. That is the other change that will you will encounter due to decrease in the oxygen levels. Apart from that, guys, what else you will see in the liver also? As someone asked me, sir, liver में क्या होगा? तो लिवर में आप लोगों को पता होना चाहिए, you will see fatty change. Okay, you will see the fatty change in the liver. Okay, there will be accumulation of lipid droplets, especially the triglycerides. Okay, especially the triglycerides, because glycolysis is like anaerobically taking place, so we have other means of generating ATP. And yes, yeah. And one more change that you will encounter in the mitochondria. Okay, there will be amorphous densities. Amorphous densities. Now these amorphous densities are due to increase in the calcium, or sorry, these amorphous densities are due to increase in the calcium. Okay, or calcium accumulation in the mitochondria. Calcium accumulation in the mitochondria. Okay, and this calcium is increased due to decrease in the ATP. If there is a decrease in the ATP, the calcium, it will be accumulated inside the mitochondria, which will like present as amorphous densities. I hope the reversible cell injury is clear to each and everyone. The miscellaneous changes happening in the liver that I have already told you, fatty change, fatty droplets, you will see lipid droplets, especially the triglyceride droplets will be there. Amorphous densities in the mitochondria, the nucleus, the endoplasmic reticulum, what will happen to it, and about the cell membrane, the myelin figures, the first microscopic change, and the yeah, mitochondrial dysfunction that you will encounter. Just give me a thumbs up, guys, that you all have understood the reversible cell injury and what is happening to the various organelles in the reversible cell injury. So I'm waiting for your thumbs up, everyone. Yeah, Ritika, it's perfectly fine. Okay, if you understood this, just give me an answer of one of the question, which is the first organelle to be affected. First cell organelle to be affected in reversible cell injury. Ritika, Yasir, Rebi, Zobia, Rimsha, Minakshi, perfect beta. Perfect. I hope everyone to be answering the question. Kanchandeep, perfect beta. Perfect. Hmm. Which is the first cell organelle to be affected in the mitochondrial? Okay, I already spoke the answer, I suppose. Minakshi, yeah, it's right. Yes, it's right. Uzair, Kurapati, Yasir, Kanchandeep, Tushar. Yes, it is the mitochondria. Mitochondria. Perfect. Perfect, guys. It's the Osama. I have not mentioned it, guys, but just mention in your notes that the first organelle that is affected in reversible cell injury, it is the mitochondria. It is the mitochondria. It is the mitochondria. Okay. Now, guys, coming on to the irreversible cell injury. Coming on to the irreversible cell injury. Now, can anyone answer me before just I start with the irreversible cell injury? What is the most important ion that is responsible in cell injury? What is the most important ion that is responsible in the cell injury? Love you, sir, from Pakistan. I also love you guys. Like, yeah. Anyone? Which is the most important ion in the cell injury? Hmm. No. Alim, it's not sodium. No. Purapati, it is not sodium beta. It is the calcium. It is the calcium. Okay. It is the calcium, guys. Hmm. सोडियम नहीं है बेटा, इट इज द कैल्शियम. देखो ऑक्सीजन की कमी से क्या होता है, सिवियर अमाउंट ऑफ कैल्शियम इज लाइक इंक्रीज. या हाँ, it is the calcium. It is the calcium, guys, not sodium. It is the calcium. So now, guys, you already know that if there is persistent ischemia, that is the obstruction, you already know, or there is persistent decrease in the levels of oxygen. अगर ट्रांसिएंट होता है तो इट इज द रिवर्सिबल सेल इंजरी, कि थोड़े टाइम के लिए ऑक्सीजन सप्लाई बंद थी, दोबारा से देती, अगेन इट विल लाइक reverse back to its normal function. But if there is persistent ischemia, there is persistent decrease in the levels of oxygen, what will happen? What will happen? Ultimately, the cell will undergo, the cell will undergo, yes, death. And that is, you already know, it persists in two ways. You already know the very first one, that we already know that we have mitochondrial dysfunction. If there is decrease, हाँ, not back to normal, मुझे लगा पता नहीं तुम वो तो mitochondrial dysfunction होगा. And you already know mitochondrial dysfunction, it is due to decrease in the levels of oxygen. What will happen? Now it is persistent, it is for a long time, it's for a chronic period. What will happen? The cytochrome C will leak into the cytoplasm from the mitochondria, will leak into the cytoplasm. Mitochondria से निकल के it will leak into the cytoplasm. It will leak into the cytoplasm, and ultimately it will lead to apoptosis. That is our topic in irreversible cell injury to be discussed, and you already know it refers to the programmed cell death. It refers to the programmed cell death. Okay, it refers to the programmed cell death. Yeah. Apart from that, if we talk about the necrosis, okay, necrosis, it can manifest in two ways. One is the apoptosis, and the other one, it will be the necrosis. Necrosis is basically due to decrease in the levels of ATP, and decrease in the levels of ATP is due to hypoxia. You already know this. Decrease in the levels of ATP, it is due to hypoxia or decrease in the levels of oxygen. Okay, what will happen? The energy dependent calcium pumps fails. Now there is a pump, okay, there is a pump that is dependent on, there's a calcium pump which is dependent on ATP. Now if this ATP is not working, the calcium dependent pump will fail. Okay, now calcium which was moving out of the cell through this pump will now accumulate inside the cell. Okay, now the calcium, with the help of this pump, the calcium was able to move out of the cell. Now suppose this is a cell and this is a pump, and this pump, the calcium pump, is basically functioning because of ATP. Now ATP is not there. ATP is not there. What will happen? ATP is not there. The calcium pump will not function. It will not allow the calcium to pass through this pump and move out. So what will happen as a result? There will be increase in the calcium inside the cell. Inside the cell. So ultimately, if the pump fails, what will happen? There will be increase in the calcium inside the cell. Inside the cell. Okay. And it will manifest as mitochondrial densities. It will manifest as mitochondrial densities, which will lead to cell death. Okay, which will lead to cell death, and it will also manifest as enzyme activation. There will be multiple enzymes which will be activated. Can anyone tell me the name of the enzymes which will be activated? One I have already told in the beginning. I'm waiting for your answers in the chat box. Raj Ahmed. Okay, perfect. Bache, bless you. Mohammed, yeah, activation of enzyme. The very first enzyme, PDH नहीं है. मीनाक्षी short forms use करो, but just tell me the accurate name ना. हाँ, it's the phospholipase. मुझे पता वो यही कहना चाह रही थी. So it is the phospholipase. Okay. Apart from this, yeah, Alim, it is right. It is the lysosomal enzyme. Yeah, it is the lysosomal enzymes. Phospholipase. और एक और enzyme होता है. Can anyone tell me the name of one more enzyme that is like over there? नहीं बेटा, ये तो तुम पता नहीं कौन से डीप में चले जाते हो ना कंचन दीप, नाम के साथ ही तुम डीप में एकदम कूद पड़ते हो, बिल्कुल बिल्कुल ही डीप चले जाते हो. कभी कभार ना सुपरफिशियल भी मजा आता है पढ़ने में, तो सुपरफिशियल भी रहना चाहिए इंसान को. ज्यादा डीप जाना है तो फिर ट्राई सम अदर मीन्स, बट ओवर हियर या न्यूक्लियस या यासिर सरवर्श रेबी. परफेक्ट अलीम, परफेक्ट परफेक्ट बेटा, तीनों नाम तुमने लिख दी हैं, तो यहाँ पे जस्ट अब मेंशन कर लो. इट इज द फॉस्फोलाइपेस. अभी सिर्फ ओसामा हम लोग जनरल बात कर रहे हैं. फॉस्फोलाइपेस, लाइसोसोमल एंजाइम्स, और एक और मेंशन कर लो, दैट इज द न्यूक्लियसिस. न्यूक्लियसिस न्यूक्लियसिस. चलो परफेक्ट. चलो ये तो हो गया सब लोगों का, ये तो हो गया. चलो ओके. अच्छा, अब इसमें कुछ चीजें डालो, लिखो. So if suppose there is lysosome enzyme activation, it is write down the most important. And if these enzymes get activated out of these three, it will surely lead to cell death. It will surely lead to cell death. Apart from that, we have nuclease activation. We have nuclease activation. Okay. Now what is happening? You already know we have a nucleus. Okay. Homogeneous appearance of the nucleus. We have homogeneous appearance of the nucleus. Now this normal nucleus can manifest in three ways. Okay. What will happen? This will manifest in three ways, three stages. Okay. The very first one that you will see, there will be pycnosis. There will be pycnosis. That is the ink dot nucleus. That is the ink dot nucleus. Other than this, we will have nuclear fragments. that is carrier hexes, which simply means nuclear fragmentation. Nuclear fragmentation. I will show you the images as well, don't worry. And further, the nucleus is fully destroyed. It will be karyolysis. Karyo word is basically associated with the nucleus. Okay. Rexes, fragments of the nucleus. Okay. And ultimately, we have the karyolysis. Karyolysis. It is the total breakdown of the nucleus. Total breakdown of the nucleus. We have total breakdown of the nucleus. Yeah, we have total breakdown of the nucleus. So over here you can see a normal nucleus in the very first image. You can see the normal nucleus. So yes, it is the normal nucleus that you can very well encounter over here. Then the very first image, that is, you can see the ink dot nucleus, that is pycnosis. Okay, you can see the ink dot nucleus very well in the image. Apart from that, you can encounter the nuclear fragments over here. The nuclear fragments, nucleus is breaking down into pieces. So we have the carrier hexes, that is the nuclear fragmentation. That is the nuclear fragmentation. And ultimately, at last, everything is dissolved. That is the complete breakdown of the nucleus. That is the karyolysis. Karyolysis. So this is something which you see in irreversible cell injury. If there is an enzyme that is called as nuclease, if it is activated, it will lead to the degradation of the nucleus in such manner or such order. Okay, such manner or such order. So I hope this is clear to each and everyone. Just give me a thumbs up in the chat box, guys, that you all are present over here listening me out. So we are discussing about the irreversible cell injury. And in irreversible cell injury, the major three enzymes which are activated, the lysozymes, if they activate, they will lead to cell death. Nucleus activation will lead to some further stages that I've already shown Osama, Yasir, Minakshi, perfect बेटा. What about rest? बाकी सब सो रहे हैं क्या? जिंदा हो कि नहीं हो? बैंगटन. तुम लोगों के नाम ऐसे होते हैं ना, मतलब कभी कभी तो आई प्रेफर कि तुम लोग को कॉमेडी सर्कस ज्वाइन कर लेना चाहिए. तुम नाम से टीआरपी ले आओगे. अभी तो क्या है, ये ऑफिशियल चैनल है, अदरवाइज आई वुड हैव टेकन आउट सम नेम्स ना, तो फिर ज्यादा मजा आता. बट इट्स ओके. ऐसा सोचते कहाँ से हो? बैंग बैंग मतलब इन चीजों के लिए हिम्मत कहाँ से आती है? मतलब अंदर कोई मोटिवेशन कहाँ से मिलता है तुम लोगों को? यस, रितिका, ओके, यासिर, परवर्श, तुषार, ओके, राजेश, सिद्धि, ओसामा. चलो मतलब आए, ठीक है, होता है, ठीक है. ओके, चल चल. गर्लफ्रेंड से सर, गर्लफ्रेंड से ऋतिक रोशन से. अच्छा, बैंग बैंग वाला, वो वाला हिसाब किताब है क्या? इतने फैन फॉलोअर्स हैं क्या यहाँ पे? गर्लफ्रेंड जैसे ही बेटा किस्मत है उसकी, मुझे लग नहीं रहा उसकी एक आध भी होगी. जिस तरह के कमेंट्स आ रहे हैं ना, तो इट्स वेरी मच डिफिकल्ट टू बिलीव कि एक आध भी होगी तो वो लिखे कुछ ऐसा. मेरे से तो कोई मोटिवेशन नहीं मिलता. टिक के बैठ जाओ 2 घंटे, वो सबसे बड़ा मतलब प्लस पॉइंट है कि तुम लोग बैठ के पढ़ लो. मेरे से मोटिवेट होगे तो बेरोजगार हो जाओगे बिल्कुल. एनीवेज, नाउ one more thing that I wanted to discuss over here. Yeah, it is about the phospholipase activation. Phospholipase activation. Now, if suppose the phospholipase gets activated, what will happen? It will lead to cell membrane damage. It will lead to cell membrane damage. Okay, it will lead to cell membrane damage. Now, if suppose I take an example of a cardiac cell, if suppose I take an example of a cardiac cell, okay. Now, in a cardiac cell, there is an intracellular enzyme. Can anyone tell me the name of this enzyme which is present intracellularly? Yes, I'm just leaving a dash. I'm waiting for your answers right now. You people to answer. Yeah, there's an intracellular enzyme. Yes, Rajesh, very good, beta. Very good. It is the troponin which is present inside. It is the troponin. Yeah, Sarvash, perfect. Yeah, it is the troponin, guys. Apart from that, this enzyme, okay, if suppose there is a damage to this particular cell, if suppose this is a reversible cell injury, if suppose this is a reversible cell injury, or if there is an irreversible cell injury, a cell can undergo both the cell injuries, reversible and irreversible cell injury. रिवर्सिबल सेल इंजरी में ऑक्सीजन कम टाइम के लिए लाइक ब्लड सप्लाई कम टाइम के लिए ट्रांसिएंट लॉस ऑफ ऑक्सीजन डिप्लीशन ऑफ ऑक्सीजन विल बी देयर irreversible में persistent decrease in oxygen levels would be there. So cell can manifest in both the ways. Reversible if there is about for a limited time the oxygen supply is less. Irreversible if persistent depletion in the oxygen levels. Apart from that, what will happen now? What will, if you already know, the cell will swell. In reversible cell injury, what is happening? The cell becomes bigger. I already told you the cell becomes bigger, hydropic change. There is no membrane damage. No membrane damage. Now my question to you people is कि reversible or irreversible में membrane damage is seen in which injury? Reversible or irreversible, and why? Chalo, now you are going to answer this. Everyone is going to answer this. Everyone is going to answer this कि reversible or irreversible में why I have written no membrane damage over here. What is the reason, guys? I just want an answer from you people. Meenakshi says it's an irreversible injury. Okay, why? Why? Why it is in the irreversible? Yeah, it's in the irreversible. Okay, I've already mentioned, but what's the reason? Ultimately, there is activation of phospholipase in irreversible cell injury. There is activation of phospholipase in the irreversible cell injury. Yeah, long-term oxygen depletion, less in the ATP levels. Yes. Very good. Perfect, Rajesh. Osama, perfect. So, yes. Now, there is no membrane damage, so the cell architecture is preserved. What will happen? Enzymes won't leak out. Enzymes won't leak out. Enzymes बाहर नहीं आएंगे हार्ट से. They will remain inside. Okay. What will be there? There will be enzyme levels will be normal in blood. Normal in blood. And ultimately it is seen in a condition that is called as angina. Now, can anyone tell me what is angina? Angina pectoris. Angina pectoris. Anyone in the chat box would like to answer? Yeah, angina pectoris. What is angina, guys? I hope you might have encountered patients of angina as well. Yeah. Irreversible में क्या होगा? The membrane will damage. Membrane damage. Why? Because in irreversible cell injury, phospholipase activation है. और membrane किसकी बनी होती है? Phospholipids की बनी होती है. Membrane किसकी बनी होती है? Phospholipids की बनी होती है. Yes. Status studio. Yeah, Shivansh, it's the acute pain in the chest, less blood supply to heart. Yes, everyone. Very good. Demand and supply is deficit. Perfect. There's an imbalance between the both. Meenakshi perfectly told. Yeah. So ultimately, if the cell membrane is made up of phospholipids, if suppose phospholipase is there, phospholipase will break the cell membrane. So in irreversible injury, you will see the membrane damage. If the membranes are damaged, the enzymes will leak out. Enzymes in cardiac cells, they will leak out. Yes, Kanchandeep, it is right. They will leak out. There will be increase in the enzyme levels in the blood. Enzyme levels in the blood, and it is seen in myocardial infarction. Seen in myocardial infarction. Myocardial infarction. MI. Can anyone tell me what do you understand by the term infarction now? Infarction क्या होता है? Anyone tell me what do you understand by the term infarction? Chal, I've already discussed about the various enzyme activation and the irreversible cell injury. Yeah, yeah, troponin T positive in test. Yes, death tissue. Yes, yes, it is the death. Perfect, perfect. MI, I think has been covered also, I suppose. Chal. Now moving ahead, put the heading as types of necrosis. Put the heading as types of necrosis. Yes, put the heading as types of necrosis. Everyone, I hope give me a thumbs up, guys, in the chat box. That now all the audio, visuals, your jitni bhi dikkat thi, everything is fine as of now, and you all are writing notes along with me and maintaining. Sure. Ritika, perfect, beta. Sure. Now already I have told you about the necrosis manifestation. Basically, it is decrease in the ATP levels, and you already know these are the morphological changes. Morphological changes after cell death. Morphological changes after cell death. These are the morphological changes after cell death. Okay. Now, uh, in necrosis, the very first, we have different types of necrosis, and the very first one, what we will study, it is the coagulative necrosis. Okay. So we have majorly like you can see a coagulative necrosis in this particular picture. Just try to see beta कि if we are taking a particular tissue structure, the outline or the boundary of the tissue is preserved. The tissue architecture is preserved in coagulative necrosis. Tissue architecture is preserved. There's changes in the tissue architecture. Okay. Yeah. The cell structure is preserved. The cell structure is preserved. So write down over here that coagulative necrosis, it is the most common type of necrosis. It is the most common type of necrosis, and along with that, it is the most common cause is ischemia. Most common cause is ischemia. Just to remember, guys, tell me what do you understand by the term ischemia. Already I have done. Already I have discussed this. The most common cause of coagulative necrosis is ischemia. Now, this coagulative necrosis, it is due to denaturation. It is due to denaturation or inactivation of Decrease in the hmm, hypox. Most common cause of hypoxia is ischemia. What do you understand by the term ischemia? Ischemia क्या होता है guys? I've already discussed in the last class. I want an answer from you people. What do you understand by the term ischemia, guys? Huh. Sarvarish, yeah. Suppose this is a vessel and this is a cell and this is an artery taking blood. If this is blocked, what will happen? The supply to oxygen will decrease to this particular cell. Yeah, it is simply, hmm, yeah, it is simply less oxygen supply to a particular organ or tissue or deficient in the oxygens. Okay, yes, reduce supply of blood to the cells. Very good, Ritika. Perfect, perfect. This is the answers to, like, you have to be thorough with the previous lectures that I have discussed. Only one lecture I have discussed. I think you should like if someone has not watched it previously, just go and discuss it. So yeah, it is the denaturation or inactivation of hydrolytic enzymes. Hydrolytic enzymes. Okay, it is associated with. It is associated with all organs. It is seen in all organs. Coagulative necrosis except CNS. Put this in dollars. Yeah, except CNS. Just put this in dollars. Okay, put this in dollars. Okay, yeah, and what else you can see over here is Zenker's degeneration. Zenker's degeneration. Yeah. Now Zenker's degeneration is something which is coagulative necrosis seen in skeletal muscles, seen in skeletal muscles. Yes, seen in skeletal muscles. Okay. It is also associated with typhoid. Yeah. In brain, it is liquefactive. Rajesh, very good. Yeah. Rajesh, very good. Okay. Now coming to an important term that is called as infarct that I was already discussing when I was discussing myocardial infarction. But let us just understand the term infarct. Infarct. Now what is happening, guys? If suppose this is a blood vessel, if suppose this is a blood vessel, it can be an artery. Okay, it can be an artery, a very common thing that is an artery, and this artery is taking blood to a particular organ. Now if suppose this blood vessel is blocked, okay, due to the deposition of cholesterol or lipid droplets or something, if this is blocked, the amount of blood which was going earlier will now be reduced. Up the amount of blood, if it is reduced, what will happen? The amount of oxygen, it will also decrease. The amount of blood decrease, blood carries RBCs, WBCs and everything, and they carry oxygen, so the amount of oxygen will decrease. So if suppose this is a cell or any particular organ, what will happen? If suppose this is any particular organ, what will happen? This organ, the various areas in this organ will start, like, due to depletion of the oxygen, what will happen? It will start turning its color, it will start changing its color, okay, due to loss of oxygen. Due to loss of oxygen, yes, Rajesh, it is the apex. So what will happen? There will be formation of an infarct. There will be formation of an infarct, and this is the infarct which you can see. And this infarct is basically due to decrease in the levels of oxygen, decrease in the blood supply to that particular area, and it will manifest like this with a base that is called as the, sorry, with an apex, and ultimately with a base. Ultimately with the base. So remember that the apex basically points the direction of infarct, points the direction of infarct and and the site of obstruction and the site of obstruction. Okay, and infarct is basically nothing but a localized area formed due to ischemia formed due to ischemia. It is a localized area formed due to ischemia. It is a localized area formed due to ischemia. Now, we have two types of infarct. We have two types. We have white infarct and we have red infarct. Now, in the white infarct, remember, seen, it is associated with organs. It is associated with organs with end arterial blood supply, end arterial blood supply, particularly in solid organs. Example, heart and kidneys. And red infarct, it is basically seen in loose connective tissues, loose connective tissues, and it is also seen in organs with dual blood supply, dual blood supply, like lungs and liver. You already know lungs and liver are having dual blood supply. If suppose one obstruction is there, it will compensate with the other one, that is just the red infarct. Obviously, if अब suppose एक liver है, liver की दो blood supply है, lungs है दो blood supply है, तो ultimately एक अगर blockage है तो दूसरे जगह से काम चल रहा है, so ultimately it will manifest as an infarct only, but usually it will be a red in color. White infarct, basically it is having with end arterial supply, only one end artery is over there at that particular organ, for example like heart and kidneys, for example like heart and kidneys. I hope the infarct is clear to each and everyone. Yes, just give me a thumbs up guys that you all are along with me learning. Just give me a thumbs up guys that everything is fine, so that I can start with the next subtype of necrosis, that is the liquefactive and qualiquative necrosis. Just give me a thumbs up, guys, that everything is fine, normal. Yasir, okay. Osama, perfect. We have discussed so many things today. Yeah. Now, coming on to the next part, that is the liquefactive necrosis or the qualiquative necrosis. Liquefactive necrosis or the qualiquative necrosis. So, what is the difference between the coagulative and liquefactive? Liquefactive, the tissue architecture is not preserved. The tissue architecture is not preserved beta over here. Over there, the tissue architecture was preserved. Over here, there is no tissue architecture which is preserved. And remember, liquefactive is basically taking place inside the CNS. Okay, what is happening over here? There is hydrolytic enzymes activation. Hydrolytic enzymes activation. Okay, and there is damage to there is damage to tissue architecture. There is damage to tissue architecture. Okay. Examples you can see, it is seen in CNS, especially in the brain. You can see the ischemia. Okay. You can see the ischemia. Okay. So this is something called as liquefactive necrosis. Liquefactive necrosis seen in CNS. Okay. It is also associated with infections. It is also associated with infections that are associated with pus formation, guys. That are associated with pus formations, and especially these pus formations arising due to associated with Staphylococcus aureus infection. Staphylococcus aureus infections. Staphylococcus aureus infections. You can see very well this is a normal tissue of the brain. Okay, the normal tissue of the brain. Okay, the neurons you can very well appreciate over here. But when this is exposed to like liquefactive necrosis, what will happen? The tissue architecture is completely lost. Okay, the tissue architecture is completely lost. Yes, Staphylococcus. Yeah, that's the bacterial infection. Yes, yes, yes. Sure. Coming on to the next type, that is the Caseous necrosis. That is the caseous necrosis. Okay, that is the caseous necrosis. Sure. Now, caseous is basically something which you can relate. It is cheese-like. It is cheese-like. Okay, it is cheese-like necrotic material. It is cheese-like necrotic material, which you can very well appreciate. Okay, the structural outline, the structural outline, it is not preserved. It is not preserved. Okay. Caseous necrosis, you can see the coagulative part as well as the liquefactive part together, but majority it is the coagulative which is the dominant. Majority it is the coagulative which is the dominant. हाँ हाँ ये पहले था क्वेश्चन. It was yeah. hmm. It was like previous one. Yeah. Okay. I have one picture. Okay. Okay. It is now, as someone told over here, so just mention it is seen in fungal infections as well. Okay. That are, see, these are associated with tuberculosis. Tuberculosis. Okay. Now, in TB, in tuberculosis, there is a presence of an acid. Can anyone tell me, according to your microbiology knowledge, which is that acid present over here? Which is that acid present over here? It is seen in association with tuberculosis. So just tell me which, yeah, TB of the lungs. Yes. Fungal infections, I agree with the fact. Yes, stage deep, it is the systemic or the non-tubercular causes. Okay, it is also seen in syphilis. Okay, the caseous necrosis. Yes, yes, Yasir, Rajesh, Osama, perfect beta, perfect. It is the, yeah, mycolic acid. It is mycolic acid plus the fatty acids which you can, yes, yes, tasty Meenakshi, very good beta. It is the mycolic acid. Perfect. Coming on to the next type of necrosis. Okay. Coming on to the next type of necrosis, you can just see the granulomatous reactions. Okay. Over here. Okay. Before coming to that, you already know these are large. These are called as Langerhans giant cells. Okay. These are giant cells which are associated with tubercle. okay, which are associated with tubercle or the TB. Okay, basically we have monocytes, monocytes and lymphocytes infiltration are seen over here. Monocytes and lymphocyte infiltration is seen over here. Yes, and over here, yeah, granulomatous reaction is present. Okay, there is a large giant cell, that is the Langerhans cell, which is accumulating all these monocytes and lymphocytic infiltrations are seen. Coming on to the next type, that is the fat necrosis. Coming on to the next type, that is the fat necrosis. And remember that it is associated with organs with high fat content or lipase activation or lipase activation. Now, can anyone tell me high fat? Basically, it is seen in breast. Okay, if there is an injury to breast tissue, if there is an injury to breast tissue, omentum tissue, yes, and one Rajesh has already told, Yasir also told, yeah, it is the pancreas, or I can simply say the inflammation of the pancreas known as pancreatitis. Pancreatitis. Okay, so yes, have that picture over here. Okay, okay, I don't have that picture. I'll just show you. Yeah, mesentery also. Okay, now you already know. Suppose I take an example of acute pancreatitis. Acute pancreatitis. Now, this acute pancreatitis, can anyone tell me what is the most common cause of acute pancreatitis? Anyone? Anyone in the chat box who would like to tell me pancreatitis is happening, inflammation of the pancreas is there, and what is the most common thing that is leading to this acute pancreatitis? Anyone in the chat box who would like to use their 10-gram peanut size brain? Please. Alcoholic, yes, Osama, Rajesh, Yasir. Half 90% of the students for an MBBS dependent on alcohol for their daily needs. Yeah, so yeah, it is the alcohol which is at most responsible. So acute pancreatitis, you can see the gallstones, or it can occur due to any alcohol. Okay, and this will lead to activation of lipase. Now, this lipase, what is the function of lipase, beta? It will convert, or it will break down the lipids into fatty acids, fatty acids, and we have a byproduct over here, that is the calcium. Okay, now calcium levels in the blood, if the calcium levels in the blood is increased, beta, it is actually going to tell you the severity of pancreatitis. Okay, and the fatty acids and calcium, this has a reaction that is called as saponification reaction. Saponification reaction, yeah, and this is something which will give a chalk like or yellow white deposit. Yellow white deposit. Okay, so in pancreatitis, yes, yeah, chalky white appearance. So in pancreas, You will be able to see the liquefactive necrosis as well as the fat necrosis. Okay, as well as the fat necrosis. Okay, due to the deposition of fats. Yeah, that is the fatty acids. Fat necrosis is also there. Liquefactive necrosis is also there. Okay. Coming on to the last one, that is the fibrinoid necrosis. Fibrinoid necrosis. Yeah, diagnosis के लिए there are multiple things, Rajesh. You'll discuss it in surgery. There are multiple diagnostic criteria to assess the pancreas also, and we have different types of pancreatitis also. So ultimately, different diagnostic criteria are there. Gold standard investigations are there. Common investigations are there that you will encounter in surgery. It's as of now not my part to discuss over here, but yeah, definitely share your knowledge with your surgery faculty. He'll definitely help you out. But beyond that, just guys remember, coming on to the fibrinoid necrosis, and everyone is aware that the blood vessels, basically it is composed of which cells? Now the name of the cells in the chat box. The name of the cells in the chat box. Which cells, like blood vessels, are composed of which cells? Composition. Yes, Osama. शेख वेरी गुड. इसमें भी क्वेश्चन मार्क है. हिस्टोलॉजी बिल्कुल डाउन हो गया. Endothelial cells, obviously. Endothelial cell. And remember, if Vincent, epithelial नहीं बेटा, it is the endothelial cells. Endothelial cell injury, if it is there. Endothelial cell injury, if it is there. My pen started not working. Now, if there is endothelial cell injury, there will be formation of immune complex. Immune complex, yes. Now, what is happening? The walls, okay, or the vessel walls. What will happen to the vessel wall? There will be damage to the plasma protein. There will be a damage to the plasma protein in the vessel wall. Okay, and inside the vessel wall, there will be deposition of plasma protein. You can see there will be deposition of plasma proteins, and that is something which is, yeah, it is seen in hypersensitivity. Yeah, pink and fibrin appearance, you can very well appreciate, guys. Yes, it's very good, nice. And it is the fibrinoid necrosis. It is the fibrinoid necrosis. This is the lumen which you can see. Yeah, it is the lumen, and around the lumen you can see the fibrinoid necrosis. That is the pinkish wall everyone has seen. Yeah, yes, perfect. Fibrinoid necrosis, yeah. And one example I think one of you has given me. Yeah, it is about one example like you have given in fibrinoid necrosis, just write down. It is seen in, or it is associated with, malignant hypertension. Malignant hypertension. Okay. It is seen Eshkov bodies. Eshkov body. Can anyone tell me where do you find Eshkov bodies? In which particular heart disease, or sorry, heart disease, in which particular, yeah, you will encounter Eshkov bodies? Because I hope the ma'am has already discussed this earlier with you people. So just let me know Eshkov bodies and immune complex disorders. I hope someone has already told Yasir. Yeah, it is the three immune complex disorders: mitral valve infective endocarditis, Eshkov bodies. Yeah. Hmm. Hmm. Sure. Immune complex disorders. Yeah, it is the type 3 hypersensitivity reaction. Okay. Hypersensitivity reaction. Hypersensitivity reaction. It is type 3 hypersensitivity reaction. Yeah. So fibrinoid necrosis is done. Fat necrosis done. Very easy. Caseous necrosis done. Liquefactive done. Coagulative necrosis done. All the subtypes of necrosis is done. The changes in the irreversible cell injury in the various organ due to various enzyme activation done. Pathogenesis discussed. Reversible cell injury and the various cell organelle damage done. Done. I hope, guys. Today I think I should I'll stop the lecture. I will continue with apoptosis. Okay, and cell pigmentations are there. Okay, so in the next class, I hope you all learned a lot of things today. And yes, a little more. One lecture is left. I hope of yeah, one lecture is left as of now. I hope you all learned everything. You all understood all the concepts that I have discussed today. Okay. Sure. Apoptosis I will discuss in the next class. Apoptosis I will take up separately in the next class. Yeah, I hope you all enjoyed learning with me. So yes, thank you for your patience. Thank you for listening me out. Yes. Apoptosis I will be discussing it in the next class. Yeah. Any doubts, just please text me on my personal number. I've already shared in the previous lecture. Um, Next time lecture, please just tell or post a comment on this particular channel that when is the next lecture. So I will be intimated soon, and then I'll intimate you guys. The more you will ask, the more you will get. That's the simplest reason. Okay. Yeah, gangrenous is left, wet and dry gangrene. Yasir, I will be discussing it soon in the next class. Yeah, apoptosis is left, and a little bit of cell pigmentation वाला भी topic रहेगा. So I'll be taking up in the next session, I suppose. यासिर, ओके बच्चे, ओके. तुम्हारा लैगिंग मेड स्टूडेंट अभी स्टार्टिंग में थे और अब वो अभी तुम्हारा लैग कर, अब तो मैं जा रहा हूँ. बाय बाय, टाटा. हो गया आज का लेक्चर. चल, गुड बाय, ब्लेस यू ऑल. ओके, I'll